Hi, welcome back to my channel. My name is Dr. Carl and I am a paediatric emergency medicine doctor in the UK. We have been discussing the various elements of eating disorders in children. Here today we will be looking at important principles that underpin good quality care. We will be thinking about how we can plan ahead and again look at different perspectives around these conditions. Like when navigating a map, it can be helpful to have some key guiding principles to help you navigate this difficult terrain. A few examples include staying relentlessly kind, but having boundaries. Caring for the child, but hating the disease and understanding the difference. Being consistent as much as possible. Keeping things simple. And regardless of the highs and lows, trying to hold hope. When a child has developed an eating disorder, the language used around them can be a trigger in itself. Be careful what you say. The words healthy, looking well, doing well, can all be taken potentially to mean looking overweight, for example. Words like strong, brave, success may not have the same meaning to the young person as it does to you. Throwaway comments that are overheard can also be harmful, so be careful about the language you use, but try to be sincere, honest and genuine, and but just be thoughtful about what you're saying. As a parent or health professional, beware of being a backseat driver. An eating disorder is a long drive, and the young person needs to navigate it. Yes, with support, but through empowerment. The journey might need to be broken down into phases. It may seem more convoluted than necessary. They may appear to be going slow and steady, and it might feel like progress is not being made. But it's important that they themselves are the driver. It's as important so it leads to lasting recovery. The words tug of war are often used in the community of families where an eating disorder appears to be pulling their child apart. It typifies the experience of those having an eating disorder. They, the young person, and perhaps their network, may feel in a tug of war with the disease, the eating disorder. They may also feel in a tug of war with us as professionals, or in a tug of war with their family. Our job is to stabilize things. We have to strengthen the rope and keep making constant adjustments and strategies to help them to win. Here is another analogy, the game of snakes and ladders. Progress is rarely a straight line. 1 step forwards, 2 steps backwards is a common experience. Perseverance is key. There are ups and downs, and sometimes unpredictably, it is harder and they fall far. Other times, remarkable progress is made. So, what can we do to help young people going through such challenges? How we communicate matters. Empower young people to take responsibility whenever possible. Work with them, show them empathy, support their choice, and realize that they are likely to minimize or deny having any difficulties. At school, perhaps it's possible to provide meal support, give them extenuating circumstances for exams. With speaking to families, explain it's likely to be a hard journey for them all. Be honest, be realistic, and encourage them not to make promises around food, because it's often difficult to keep these promises. How about physical health? Remember, psychological recovery can take longer than physical recovery. Avoid commenting on physical appearance, as this may delay the recovery of their mental health. Ultimately, helping their psychological recovery is the way to help their long-term physical health. And then with respect to their mental health, continue to validate their feelings. Focus on their strengths. And don't be afraid to ask if they're feeling like self-harming or feeling like killing themselves. It's important to ensure that a young person is feeling safe. Be patient, take time, and also find time to talk about other things. And of course, don't forget the needs of the siblings. Consider young carer support, mentorship, or buddying schemes. To conclude this section, we're again going to listen to this young person and hear what they found was helpful.
I think, although I wouldn't have said it at the time and I wouldn't have admitted that this was helpful, I think trying to support me in a bit of a tough love kind of approach worked, having that kind of understanding and, that kind of support, like, yeah, I'm here if you need me, but also, like, you need to eat at the end of the day and you need to gain weight or whatever. That kind of approach, I think, did help. I hated it at the time, but I think I needed that kind of direct push, particularly from my parents, to start getting over it. In terms of support from other professionals, for instance, my teachers, most of my teachers were actually really lovely and supportive. I think there were some issues with the more senior staff members in that they didn't necessarily appreciate or understand what I was going through and thought I was kind of just like every other stressed year 11, for example. But my actual teachers were really understanding and tried to... One of them actually had an eating disorder herself as a teenager, and she was incredible, actually. She kind of did everything she could, and she was very supportive. She actually offered to kind of eat lunch with me at times when that was becoming quite difficult, and just openly kind of talking about it. I think for just people to kind of say that, I'm here if you need me, I think was very, what's the word? It was very reassuring. So I think a mixture of the kind of tough love, but also the willingness to help you and support you, I think was very important to me.
I think for myself, definitely having my family there for me was super important. Seeing my family being affected by my eating disorder definitely encouraged me to recover, and having their support and having them there to listen to me just talk about how I was feeling really honestly and in a way that may have not even been understandable to them, but just to have someone there to say, I'm feeling like this today, I'm struggling with this happened and it really triggered me, was really important. And I think for me as well, it was having them there to remind me of, it sounds silly, but of who I was when I was little, and would I have done this to my 4-year-old self? And obviously not. So in my recovery, this is very specific to me, but I took a trip to Disneyland with my parents, and it reminded me of how I should be, because I didn't want to ruin Disneyland for myself. So I ate and I had fun, and it was difficult, but I think that was the sign of, oh, I'm really treating myself badly, because I wouldn't do this to anyone else. I wouldn't wish this upon anyone else. So I think definitely having my family support and their understanding helped me a lot. And also resources online. There are a few YouTubers that I watched who had been through recovery and made videos on recovery, who's just seeing their journey and having them talk about their journey and feeling like I wasn't alone at this weird, horrible experience that I thought was unique to me. They were saying the exact same things, the exact same sensations, things that I hadn't even noticed. I couldn't articulate myself. I was seeing them articulate, and that made me feel like I wasn't alone. And
Next time, we will be delving in to treatment and be looking at the medical emergencies in eating disorder guidelines for use by healthcare staff. See you then.